And we are live.
They've won Tonys and Oscars and Emmys and Grammys. There's no red carpet because they're home in their jammies. From Melrose Place to Broadway to Janeway and her crew. Let Seth and James bring all the stars to you.
Anywho,
they're entertaining everyone, so who's gonna grouse? Just sit right back and you'll hear some tales on Stars in the House.
still got it.
Hi, everyone. Welcome to Stars in the House. I'm James Wesley, and there's no Seth Rudetsky. He is in New York City. I am here in my hometown. Oh, hi, Seth, in Dallas, Texas. My mom and I got here yesterday. We're leaving tomorrow to go back to New York because Seth and I'm so excited. We got invited to the opening of Bad Cinderella, so we're going to that tomorrow. So we were going to be here for 3 days. I'm here for 2 days. One of my aunts, my mom has 3 sisters that live in the Dallas area. One of them was in the hospital, and she's out. But we were sort of like, I think all of us have sort of made a lot of major decisions in the last couple of years, and one of them is to maybe not take things for granted. And so my mom and I were like, you know what? She's out of the hospital, and God willing, everyone's health will be really good for a long time. But I said, let's just go down there, even if it's only for a couple of days. We've had the best time. Really busy, and we actually went straight from the airport. Because, like I said, we just got to DFW yesterday, like at 1, and went and had lunch with Kara Serber, who's done so much for Stars in the House, and so there's my mom and me and Kara, and then we went today. We have a lot to talk about with Dr. LaPook. By the way, we're here for the medical check-in because last week, on March 16th, was our 3rd anniversary of Stars in the House. Which, by the way, we are here for the Entertainment Community Fund, which used to be the Actress Fund, which, as I'm sure many of you know by now, is for everyone in any professional in the entertainment world, from coast to coast, and helping you with housing and food and insurance and anything that you need to get back on your feet. The Entertainment Community Fund is there, and yes, you can go to entertainmentcommunity.org for help, or if you're able to give, as many people did last week. And when Dr. LaPook comes on, we're going to read some of the donations we couldn't read last week. You can donate at starsinthehouse.com and forward your donation and receipt to donations at starsinthehouse.com. So anyway, so that's why we're here. We're going to give the grand total, which Seth Rudetsky doesn't even know. Maggie just sent it to me, what we got, what we raised just from last Thursday, and then people who watched it on Friday. So just for 24 hours. Really incredible, beginning our 4th year right now. And by the way, before I show you some of these pictures from today and we bring on Dr. LaPook, we've got Anika Larson is getting together an Almost Famous game night in celebration of their Broadway cast album coming out next month. So that's going to come up in the next few weeks. And as you know, if you were here in January and so you saw Broadway Green Alliance, and Seth and I hosted that from New York, live in front of an audience. We're working again with them, and David Katz is going to be there, making sure that happens from Times Square on Earth Day in a few weeks. And so we're going to be working with her. That's going to be simulcast right here on Stars in the House. So those are the 2 dates I know for sure that are going to be coming up in April. So anyway, so like I said, my 3 aunts are here and my mom, and my great grandmother, who I was inspired by my play in Broken Circle based on her life. Everyone called her Grandmother Angel because that was her last name. And they lived in Denison, Texas, which is just south of the Oklahoma border. And this is something maybe you don't, maybe maybe I didn't know. You can literally, we didn't know where. If my mom wanted to go to the cemetery. My mom wants to be cremated, has never said I want to go to a cemetery ever. But yesterday on the plane, she was like, I want to go to the cemetery where my grandmother's buried. The problem was, other than Denison, Texas, she didn't know. And apparently there are 18 cemeteries in Denison. But thanks to Google, I was able to pinpoint where she is buried. But then when we got there, it was like, where? It was the first cemetery, Oakwood Cemetery in Denison, first one in this little town, which, by the way, birthplace of Dwight Eisenhower, right there. We went there today. And and we didn't know where, but there's a website where you can literally type in the person's name and when they were born and died, and not only will it tell you where the person was buried, it also had the section number. So it was like we were able to find it, and it's where and we were able to clean it up a little bit. There you can see on the right is where my grandmother and her husband were buried, and then to the left, can't really see it. Maybe I can see it there. Oh no, that was my another one there, a relative, a great uncle. But the one on the left, my great uncle Robert was killed like in World War II, about a month after he turned 21. And so we kind of, next time we said we would go there and really clean it up, and my mom wants to plant some perennials there. There's an old cemetery, no one keeps it up. But we went there. It was a great bonding experience. And then we went to my other aunt's house, and I took some pictures that she had. This is my grandfather when he was in the Navy, and there's my grandmother. And I took this other picture. That was my grandfather. I'm named after him. His name was James. And this is when he was 2 or 3 years old. And so this was taken in 1923. So it was really been fun. I'm going to probably go and collapse, get ready for the opening tomorrow, and then go home and sleep, because it's been a jam-packed time because I've been doing health driving, and you do a lot of driving in Dallas. Just have to give a shout out to my husband, Seth Rudetsky, because he still has the #1 book in Broadway and musicals, right there, Musical Theater for Dummies. And if you're in the New York, New Jersey, tri-state area, you got to go see him and Cheetah this Saturday. I'll be there. My mom will be there. A lot of people will be there. And if you haven't seen the two of them together, you are indeed missing out. And I just say you got to go. I think that's it, because I'm going to bring on Dr. John LaPook, Chief Medical Correspondent of CBS, and we have the great honor that he is still with us, beginning literally, John. This is our 4th year. Please welcome Dr. John LaPook.
When you say I'm still with you.
Well, you're like I text you and say, can you come on? And you're like, this is beginning the 4th year, and you're still here.
You're stuck with me. It's it's actually a little emotional, and it's one of the themes I think we should be talking about right now. Just when I saw the little clips at the beginning with the opening salvo, the song, and it's just flash, 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 and it brings back these memories that come rushing back. I remember the first day of the pandemic, and then almost running out of gas and having to sleep in the middle of the night next to a gas pump because there was no gas in my tank, and I just waited for it to open, and then being on the COVID wards at NYU Langone Health in April, and not knowing what was going on. So, and my friend and colleague Mark Pachapin, who's the head of GI, saying, John, forget about everything. We don't know anything here. We know absolutely nothing. It's a novel coronavirus. It's a novel virus, and we don't know anything about it. And the reason why I'm bringing that up right now is I think this is a good moment to stop and take stock of where we've been, where we are, where we're going. A lot of the questions that we got, because this was posted on social media a few days ago, have to do with, okay, what now? And I think we should start with, we are so much better off now than we were 3 years ago. 3 years ago, when we met for the first time here, when was it? The 16th, March 16th, 2020. Wow. We had this virus that was killing people. We had no vaccine. We had no effective treatment. We didn't have PPE, protective equipment for people. People were wearing, nurses and other people were wearing garbage bags in order to protect themselves. So now, we've come a long way, but now the question that people are trying to figure out is, and I can't wait till my colleague Dr. Celine Gounder comes on, because a lot of us are facing, okay, how do you make this transition? Where are we? Is the pandemic over? I mean, May 11th, they're officially ending the federal state of emergency. What does that mean? Is that symbolic? How does it affect people? What about people who can't pay? Are they going to still be able to get, medication and testing and other services? And
do we
then
have those answers, by the way? Do we know? Do we know what those answers are?
Okay, so funny
we can dive in, and then we can just dive in.
You don't have to be smart. You just have to know somebody smart. So I will confess that I spoke to Tony Fauci today, and he said that the administration is saying that they understand that there are issues for the uninsured, and they're going to try to figure out a way to get a program like the childhood vaccine program to get the uninsured, so that they're, to address the fact that there are people who are uninsured or underinsured, so that they're not deprived of interventions because of, the end of the state of emergency. There's no granular details yet. It's vague, but there's this. That's what the rumbling is there. The other, I might as well just jump into it, and we'll talk with Celine also. I asked them about 3 questions. The other thing, the most popular question was, do you need another booster? And I know Celine, Dr. Gounder, is going to have some views about this. He said the FDA is already seriously considering and will likely recommend a booster for people who are immunocompromised and elderly, even before the fall. They've already kind of signaled that maybe each year you're going to need a booster along with, when you get the flu vaccine. So he said the FDA is likely leaning strongly in the direction for immunocompromised and other people who might be at risk of saying, we're already like 7 months from September when the bivalent booster came out. But there's some controversy about that. The other question was, there's some questions about, has this now become just like the flu? Right. And the answer is still no. I mean, you saw there were 400 deaths a day, and then sometimes it was up to 500, down to 300. I just looked at the CDC website for the last week. It was 1,706 deaths in a week. That comes up to 244 a day, which is 88,712 deaths a year, which would be a very bad flu season. Usually it's 20 to 50,000 deaths in a flu season, and so 88,000 would be a lot. And of course, if it was 400 deaths a day, it'd be a lot more than that. So no, we're not yet at the place where this is just like the flu.
Well, when Seth and I, because sometimes it's easy to just in conversation say, when during the pandemic, like as it were in the past tense, and Seth is I love what he says, which is during lockdown, and to differentiate the two, that it isn't the pandemic is over. It was during lockdown, which was a different time. And so I find myself saying that. That's number one. Number two, we were in Los Angeles last week, and we had a game night, and we asked people to either test before they came over, or we tested and we had some tests. But really smart guy was there, a friend, and he was starting to compare it. Believes in, he had the vaccine and boosters and all that, but was starting to compare it to the flu. And Seth and I were like, it isn't. And I think that seems to be the hardest thing for people to understand. It isn't the flu.
We're not there yet. And by the way, the flu can be terrible. the death rate is, it varies, but it's about 1 in 1,000. So if there's 20 to 50,000 deaths, that's 20 to 50 million cases of flu every year. The flu is, enormous. When you think about whether this pandemic is over, the flu that we have now is offspring of the Spanish flu, the so-called Spanish flu, which really didn't originate in Spain, of 1918. So I don't think we're going to ever get to a point where this is completely gone. But the question is, how do we now think about living our lives? And I think I want to start with a sort of an emotional part of it. And then when we get into talking about strategy, I want to bring Celine on, Dr. Gounder, and I'll introduce her before she comes on. The emotional part of it is I want to share with everybody that, I'm a happy-go-lucky guy, right? And, I look forward to every day, and I'm usually up. And I found myself in the fall really being down. And I think the pandemic sneaks up on you. Even as we're transitioning now to a more normal, more normal existence, we have to stop, or at least take stock of the emotional effect that it has had on us. For me, it manifested mostly in going to work, and I had to wear that mask every day. And my nose was getting excoriated and it was hard to breathe. And yes, we're used to it. And I couldn't see my beloved patients across from me. I could see this, and I want to see their whole face, and I want to be able to read their emotions a little bit better.
Right.
And it just was, I wasn't looking forward to going to work as much. And I will say that 3 weeks ago at NYU Langone, about 3 weeks ago, they said, okay, we can take the masks off. You still have to use your common sense. If you're sick, don't come in and all that kind of stuff. If you have an immunocompromised patient, maybe slap it back on. You use your head. But the baseline was you didn't have to wear the mask. And I can tell you, I have had such a turnaround in my emotions.
Wow.
Just being able to go to work and have more of a semblance of normality. And going to CBS, a lot of people are still at home, but there are a lot more people there. And being able to just walk in and see people. I went to Michelle Miller, one of our great, anchors at CBS Mornings. She just published a book called Belonging. I think that's what it's called, Belonging. It's an amazing book. You should read it. She's so excited about it. It's number 11 on the New York Times bestseller. It talks about her upbringing. I don't want to get into that, but read the book. It's really great. Michelle Miller. But they gave they've had a couple of get-togethers where for the first time really in 3 years, all of us were in one room. And I wasn't wearing a mask. We were all there just a couple of days ago. And it was amazing to hug people. And I did an Instagram about that. We're suffering from a national hug deficit. So when you hug somebody or when you look at somebody's eyes, your oxytocin hormone, the feel-good hormone, oxytocin goes up. That's the breastfeeding hormone, the maternal-child bonding hormone. There are other hormones that go up, but we've had, a national deficit of oxytocin. I think because you don't get the same thing over Zoom. We haven't been hugging each other, and it just that connection. From the very beginning, I was saying that I hated the term. What term did I hate? Social distancing.
Social distancing.
Like it should be physical distancing, and socially we have to be, more together. Anyway, for people out there who are listening right now, I really think that you should stop, look, and listen. Stop and take stock of what's happened. Give yourself a break if you're having trouble re-entering society like everybody else. I took a risk a couple of days ago.
I'm going to ask you, because there is still risk in doing that.
It's a risk benefit thing. I had COVID for the very first time in the fall. I knew I was going to get it. I went to Paris with Kate. I was on some cultural thing. I was her +1. I knew I was going to get it. We were in a cocktail party without masks. Nobody was wearing masks. I got it. I brought, I got Paxlovid, and anyway, I did okay. But right now, I'm sort of far enough away from that I'm not as protected as I was immediately after. But I just made the decision, as people are going to need to make, that it was worth it for me. And,
it's sort of like, because my mom, because we do our Broadway cruises, and we have one coming up in Alaska. I'm going to have my birthday actually on the last night of the cruise, and my mom has been hesitant to go, and she just said in the last couple of weeks, including coming here, this was her first time on a plane, was yesterday in over 3 years. And she said, what, at some point, I have all my vaccinations. I wear my mask in crowded places. She's watched when Kim Prather, I do believe it was Dr. Prather, who said, basically, if you're going to wear a mask anywhere, wear it in a public bathroom and wear it in an elevator where there's no ventilation. People are in and out. And that's what I tell everyone, that even if you're like, don't wear a mask anywhere, just wear it in those situations. Or obviously, because it just makes sense. And what is it going to hurt you? You're not going to, you're not in the bathroom or an elevator that long. Wear a mask there.
And if you,
go ahead.
If you feel like wearing it in a plane, because the ventilation's usually pretty good in the plane, although not perfect. When you're getting on the plane or off the plane, you put it back on. What I've been doing in theater, because I've been going to theater again, is I sometimes I'll just walk in without a mask. Hi, I'm seeing faces. As soon as I sit down, I put on a mask. So what? I'm in the dark, and then I take it off. I can take it off afterwards. So I think people are gonna. I think we have to give people a break. Everybody's gonna have their own risk tolerance.
Yeah.
But I think we have to acknowledge there's a generation of kids who are going to have ACEs, this adverse childhood experiences. That's going to go on. We're going to be dealing with that for generations. And I think it's every age group that's had this. People who are elderly have been isolated. We know that social isolation increases the risk of dementia.
Right.
This is not over. Even if the death rate goes down and the number of cases go down, we still need to be dealing with this.
Listen, how we did it here, because of course your voice is in my head, throughout whenever there's a decision to be made regarding COVID, and especially those who are over 65. I made sure my mom and I tested before we went to my aunt's house because I didn't want to feel responsible to giving them COVID. And that's sort of my thing. It's like I test because if I later get it, I don't want to feel like, oh my God, I gave it to, as you always said about your father-in-law. You don't want to be the one giving Norman Lear COVID. And you don't want to be the one giving your aunt or your mother or, that you can have control over. You can take a test before you go and you see them. But for them, they haven't really, other than doctor's appointments, they haven't been out of the house since COVID began. But they decided to go with us. We went to the cemetery.
That's great.
And we went to a restaurant and we were inside. It wasn't super crowded. But, as my mom said afterward, and they did too, and everyone was crying, that it just felt so good to hug and to have that experience that, it outweighed. Yes, there was, as we talked about, and I told them about layers of protection and about the wearing the mask. And we all said it. We all agreed. It was just like, look, it was the positives outweighed the potential negatives.
I have no doubt that after 3 years of isolation, especially if you're elderly, going out, the benefits of going out and reconnecting and getting the oxytocin and getting the interaction outweigh the risk. But there are risks. Look, we live in a world you could walk outside and cross the street perfectly when the light is the way green or red, depending upon which way, and you could still get hit by a car or something bad could happen. So we deal with risk all the time, but people are not used to making these on a daily basis in terms of what's the weather out. What's the weather report today in terms of COVID? Where I am,
right?
What are the variants that are out there? What's my risk? And also, don't forget, we've talked about it so many times. You mentioned Kim Prather, cleaning the air. You can open the windows, you can crack the doors, you can have the air purifier, air
Absolutely.
filter.
Getting into the Uber or taxi, you can still roll down the window. We do it every single time.
And I will say, in a taxi cab, I do put on a mask because, especially if the taxi cab driver is not wearing it, because that person's exposed to people all day long. So I'm just thinking statistically, why not put it on? So I think this is a good time for us to bring on. Oh, you want me to read some donations?
Let's take turns. We'll do it right now. We're going to take turns. It should be, you see it in the private chat. I'll get started and we can go either, trade off each one.
Okay.
Thank you both so much for me and Seth, for all you've done for not only the New York theater community, but for all lovers of the arts. Your broadcast will definitely be one of the positive things that came from the pandemic. You and James have shown us all that, I guess this was for Seth. You and James have shown us all that one person or two can make a difference. Lamont Russell from Las Vegas, $25.
Happy birthday. Thank you, Lamont. Happy birthday. Happy anniversary, Seth James and the rest of the Stars in the House family. Looking forward to reading your book, Seth. Book is great. I have it right by the side of my bed. Kevin from Virginia, $25.
Congrats on an amazing 3 years. So proud of all of you guys have done, and cannot wait to see you both again. And for the record, the book did come out in time for the holidays, your birthday and mine. Rob Johnston, $25.
Seth James, Dr. LaPook, and the Stars in the House core Sith is the anagram there for core family. Thank you. We were there watching on the first night. Wow. And are in awe of all that you've done. More than 300 shows, right?
No, I think we have it on IMDb. Cicely put it on. We're over 500.
Over 500. Well, over 300. Oh, over 500 is over 300. Yeah, it's true. Over 500. And how many people you've helped in these past 3 years? Thank you, Heather and Eugene in New York City. $37. They're the very first day. Wow.
I love it. Thank you, Seth and James, for all you do. Susan in Pennsylvania, $100.
Dear Seth and James, congrats on the anniversary. Thanks for getting us through so much these last 3 years. You guys are wonderful, and we love you. Kathy and Susan Mervine, Philly, $100.
Can't thank Seth James, Dr. LaPook, all the guests, all of the crew, and the amazing Sith Core family for all the live empathy, knowledge, and entertainment these last 3 years. We can never repay what you've all done on us. That's so nice. James from New Jersey, $50. And the last one, Dr. LaPook.
This is in honor of Dr. LaPook and his reasoned and helpful medical information throughout the last 3 years. Thank you so much, Dr. LaPook. Deborah, $25. Thank you, Deborah.
Oh, and one more popped up. Thank you, David Katz. Dr. LaPook, James, Seth, and all of Stars in the House, thank you for being there for all of us. I can't imagine life without my Sith core fam. Helene Bear, $25. And David Katz, there's one last one. So, Dr. LaPook, take it away.
Well, it's a little whatever. Thank you for being here tonight, Dr. LaPook. The Sith core family, Stars in the House core family, has missed you. Cheryl, $41. It's great to be back. I'm always happy to come back.
Thank you, everyone, for donating. Dr. LaPook, please make your introduction.
Yeah, Dr. Celine Gounder is a colleague of mine, somebody who I've gotten to know relatively recently. She's an infectious disease expert, an epidemiologist, and also was part of President Biden's the transition team when President Biden was coming in. She was part of that COVID advisory committee. Wow. She is a colleague of mine at CBS News. She's really quite brilliant and terrific. So she at the very last, I thought, why am I here alone when we're talking about all this? So Celine, come on in.
It's great to be here, John, and thanks for having me on, James.
Absolutely. I was so thrilled. Dr. LaPook texted me and emailed me, and I was like, as you know now, with the family, and so I didn't see it. And like, of course, I'm so happy you're here.
Yeah. Celine, I would love your take. You heard a little bit about what Tony said about vaccines and boosters, and Celine has done the deep dive on all this at a super deep level. What would be your spiel to people about boosters? I think the number was 16% of the country has gotten that bivalent Omicron booster in the fall, and there's been a lot of discussion about who really needs it. So Celine, take it away with that discussion, and then let's talk about how do you address the rest? What are you doing for the rest of your life?
So I think where there is not disagreement is that everybody should be getting, regardless of your age, regardless of whether you're immunocompromised or not, regardless of what underlying medical conditions you have, or if you are a super healthy person, everybody should be getting at least 3 doses of the COVID vaccine. Where it gets more complicated is, do you need further boosters after those first 3 doses? And I think some people are confused still that the 3rd dose truly is necessary. And that's something that we have learned. There is benefit from getting that 3rd dose. But beyond that, it does get to be more controversial for a number of different reasons. One of the areas of controversy is just, do you need more doses? And some of that is really about, what are we trying to accomplish? Are we trying to prevent all infections? Are we trying to keep you out of the hospital and save your life? Or are we trying to prevent long COVID? And depending on what you're trying to accomplish, that's going to lead to a different strategy. I do think that for people who are over 65, and by the way, over 90% of the deaths that we're seeing from COVID right now are among people who are over 65. Wow. For people who are over 65, I do think there is benefit in ongoing boosters. And I'll talk a little bit more about that in a moment. For people who are immunocompromised, I do think there is benefit to have ongoing boosters, because in those groups, having an infection and or preventing infection and preventing hospitalization and death are really the same goal, because the risk of infection developing into severe disease and death is much higher risk in those groups. Now, another area of controversy is this sort of bivalent booster concept, which bivalent meaning you're trying to target 2 different strains of the virus with 1 shot. And the data on that shows that the 2-in-1 approach is not as good. And so with the most recent round of boosters, we would have done better. We would have had a better vaccine had we only targeted the Omicron variant, as opposed to trying to do both. So moving forward,
the original was the original strain, right? The original strain plus the latest strain.
Exactly. So, I think that having learned from that experience, what will the manufacturers, Moderna and Pfizer do? What will the FDA be looking for? I do think that will change. Now, how often do you need to be getting a booster, especially if you are in that over 65 group, or if you're immunocompromised? Those groups would probably benefit from getting every 6-month boosters because of what we're seeing in terms of how good your immune response is up front and how quickly it wanes afterwards. That does not apply to the average healthy person. Again, that person probably is just fine with 3 doses. But for people who are higher risk, especially say somebody in a nursing home where you have both older people, immunocompromised people, those are places where we really should be thinking about more frequent boosting. And I think, some of these discussions might seem academic and, why does it really matter? I do think it matters because a lot of people are just exhausted with COVID. They are becoming more and more resistant or skeptical of vaccines. And so some of this approach of just trying to boost everyone is starting to backfire with more and more resistance, not just to COVID vaccines, but other vaccines. And that's not going to be helping us with respect to public health in general in the long term.
Dr. Gallagher, can I ask you a question regarding that? Because right before the show, excuse me, I was telling John about this, that a relative that I saw while I was here had no problem getting the first 2 vaccines, both those doses. I'm assuming Pfizer, and but did not want to get a booster. But a couple of us were trying to convince this person to get it. But what I'm hearing you say with the bivalent, like if this person were watching the show, it'd be like, well, now Dr. Gallagher's just proven my point. There's no reason to get the bivalent. What would you say to this relative of mine?
Well, this relative of yours has only gotten 2 doses. So there is no question that that relative of yours would benefit from a 3rd dose. And right now, the only available vaccine is a bivalent vaccine. Okay. So I do think there would be benefit in getting that 3rd dose, even if it's the bivalent vaccine. Okay. Now, if that relative of yours is under 65, not immunocompromised, how hard would I push to get additional doses beyond that?
Right.
Probably not that hard unless there were some other reason, that had me concerned about their risk.
But being over 65 and only having those 2 way back in 2021, it would be very incumbent upon this person to get.
Yeah, that's really not adequate protection for that person, for sure.
Yeah, and I'm sure. And then, by the way, I know that they're not alone either. There are a lot of people like that who got the first 2, and we're just like what you said, almost like vaccine fatigue. And are you seeing that, Dr. LaPook? Are you seeing that true? I mean, like, how is this affecting us long term regarding that?
I did a Sunday morning piece 5 years ago, something about vaccine hesitancy. It had to do with measles, mumps, and rubella, and there were some myths associated with that. So it was already a problem when we saw outbreaks of measles in certain communities that decided, it was dangerous when it's really been one of the most successful, vaccines ever. And, people, we're sort of a little bit punished by the success of the vaccines. We're victims of that in some way because most people now have never seen the results of polio, the results of, because vaccinations were so successful. I actually am old enough because when I went to medical school, when dinosaurs roamed the earth, I actually saw people in the drinker, like the iron lung, who had their lungs affected by polio and were not able to take deep breaths. So, nobody has that memory. And then there's been this concerted effort, which we don't need to get into about, or not enough time to get into, which has been vaccine hesitancy or just frankly anti-vaccine for whatever reason. And that, as Celine pointed out, it is now spread to basic childhood vaccinations. And that is gonna keep going, I'm afraid to say. People are just saying, I don't need it, until it happens to a loved one. And then they go, oh, I get, Celine, you must have seen this on the wards I did. People who were in the ICU who said, oh, I wish I had gotten the vaccination. That's a little bit too late. You have to do it beforehand.
Yeah, I agree. And we have certainly seen also an impact on measles vaccinations. For example, we had a big outbreak of measles in Ohio in the fall and into the early part of this year. And this is very much a consequence of people becoming more resistant to the idea of vaccination. So I think we have a lot of work to do to reinstill trust in vaccines and public health. And that also means that we have to be a little bit judicious about what we recommend and how and when, so that when we're asking something of people, it's when it absolutely is necessary.
Yeah, and as long as we're on this subject, we won't go into it too deeply, but I haven't spoken to one expert or person who I've considered to be smart. I don't want to use too many double negatives. Every smart person I've spoken to has said there will be another pandemic. There will be another pandemic. When it's going to be, we're not sure. We hope it's not soon. But what are the lessons that we've learned from this pandemic? We've already learned what doesn't work. A lot of the measures people are saying, we're not going to do it, right? So I think one of the things you start with is there's been decades of underinvestment in our public health system. And tens of thousands of people have left it. So you can't underinvest and then suddenly when there's an emergency say, okay, why we never think about that with the military, to just have no planes, no troops, no nothing, and then or underinvest, and then there's a conflict and say, why aren't we able to meet the need? So we need to really do that, and I'm afraid we're not going to, because unless there's an emergency, unless it's staring us in the face, we tend to be reactive rather than preventive, and that's really a problem. The other thing is, I think cleaning the air is going to have to take a really top priority, because that's the one thing. Who's against that? Nobody, I hope.
Well, yes and no. I think where there is resistance is among people who own or operate buildings, because there is going to be a cost there. And this is also why, whether it's OSHA or the CDC or Department of Energy, there have been a number of different federal agencies that have talked about having guidelines, but have not wanted to issue guidelines or standards around indoor air quality, because they don't want to be seen as forcing something down everybody's throats and at a great cost.
And there is an organization that is just, I'm hearing they're just about to come out with some guidelines for indoor air. We spend 90% of our time indoors, and yet there's not really been an enforcement of any kind of standard about what that indoor air should be. But you're right, especially in the newer buildings that don't have windows that open and all that, there's going to be a cost to cleaning.
So while we've been on the air, my mom is in another room down the hall, and she texted me. So she just wanted me to be clear while I've got both of you here. She said, so should I get my 6th vaccine in September?
How old are you, Mom?
Really? She's watching. John.
Okay.
She's over 65. Okay, I'm in my 50s.
And she has some stuff, some medical issue. I don't want to. I retract it. But I don't want to violate any confidences. Celine, why don't you take this?
Yeah, I think it'll depend a little bit on what the FDA does, and what is authorized, what is covered by insurance as well. But in general, I think that for people over 65, for people who are immunocompromised, we are definitely going to see at a minimum yearly shots, boosters, and we may well see every 6 months. And I think every 6 months, based on the immunology, is actually what would make sense for that group. Not for everybody, but for that group.
So to be determined, but you're saying most likely come September, come the fall, which would be about a year since people had the bivalent, we most likely will have an answer. And you're believing that it will be, if not every year, it could even be every 6 months.
Yeah, we don't know if COVID's going to be seasonal. Is it going to be like the flu, which is mostly in the fall and winter? We have had COVID waves in the summers, the first couple of years of the pandemic. They've been largely in the South, but we don't yet know how that's going to settle out, how that will pan out. And so that will also determine how often we need to be boosting.
Yeah, that was one of the
record. My mom just said it's okay to say I'm almost 75.
We remember at the beginning we said, the virus likes cold and dry. So in the summer it's going to be hot and moist, and it's just going to, maybe it'll wilt. It didn't read the book.
No.
So, that was one of the problems.
Yes. Anything else that we're leaving out before we say goodnight, Dr. LaPook?
There was something I was just thinking about. I think basically that you were asking, is it going to be seasonal? And I think we don't know. We don't know when it's going to come exactly. But it's gonna be with us for a long time, and I think we just have to. I'd love to know, Celine. How are you living your life?
Yeah,
I have finally started eating indoors in restaurants again. This is something I've started doing probably late February, early March, because that's when we got past the winter wave this year, and we saw transmission really drop. I am still masking in the hospital. And I will say I work at Bellevue, just next door to NYU, and our rules are a little bit different. As healthcare providers, we are still required to wear a mask in patient care areas. In private workrooms with our colleagues, we can take them off. And I am still masking at the hospital. I have at least one patient who I know has gotten COVID in the hospital, so it's not like there is no risk. And so I do think that's worthwhile. And then, some of the other places I still mask are on the subway, in a taxi, during takeoff and landing on a plane. I use the fasten seatbelt sign as the signal to know when I can take off my mask or when I need to put it back on. So I'm still taking certain measures to reduce risk. And I think they're pretty easy to do. I don't think anyone really enjoys having a cold or being sick. And so if these are easy things I can do to avoid that, I have no issue with that.
That's the other thing, which is we have to change a thing in our culture, which is I'm sick, but I'm going to tough it out and I'm going to come to work. Absolutely not. You need to stay home. I do the same thing. I just visited a very sick patient in the hospital at Tisch, and absolutely I wore a mask, the whole time. So I think inside of a hospital, especially if you're in the room of somebody who's sick, again, use your head. But and my taking off the mask is in the outpatient setting, and I know these patients, and they all know that if they're sick, they're going to stay home. Of course, they could have asymptomatic. Right. I haven't gotten to the point where I have them test in the last 3 weeks before they come in, but I still am. Everybody's doing it differently. I still tell people before they come in for a procedure to test, even though it's not absolutely required, just because I want to know, they're going to be in there and there can be a lot of people in the room and it's a closed room and they may not have a mask on if they have oxygen. So they may be breathing out and, I just want to protect everybody. We are in this kind of twilight zone right now, right? Where people are having different guidelines.
Yeah, I think the other thing I would say, and this sort of piggybacking on some of what you were saying, John, about where we are. I mean, we're going to live with COVID. COVID's going to be with us pretty much indefinitely. And I think we've been too reliant on measures that require individuals to take action. I don't know if you can trust people to always be testing, to get vaccinated when it's recommended, to wear a mask when they're asked to wear a mask. I think we've seen a lot of people who've decided they just don't want to take that kind of action to protect others and just aren't worried enough for themselves to do those things. And so that really means you need approaches that do not require individual action. And so cleaning the air is one big one. And then I think some of the other things that would really make a difference are family medical leave or sick leave and family medical leave, so that if you are sick, if your child is sick, you can stay home when you're sick, or stay home with your child when they're sick and not be spreading at work or at school. I think that's something that people would take advantage of that if that were paid. I think health insurance is another really important one, where these are decisions that are made at a societal level, but for people to take action, to seek treatment, to seek out other kinds of healthcare, having health insurance is a major barrier still, or not having health insurance is a major barrier still for many Americans.
Yeah.
So my mom is being producer here. She said a person, because I'm not able to read the comments right now. One person asked, what's the difference between wearing your mask on for takeoff and landing versus during the flight? I mean, I think I know, but You're the doctor, not me. So what would you say to that?
Yeah, so the airplane doesn't necessarily have its ventilation systems on during takeoff and landing. And I've actually done this experiment of one of those bringing on a CO2 monitor to see how high the carbon dioxide levels, like when you exhale, you're breathing off carbon dioxide. And I've done the experiment to see what your carbon dioxide levels are on the plane, and they are extremely high during that boarding because you have people who are crowding in, the ventilation systems are not on. So there's a lot of risk in those moments. Whereas once you're up in the air and the ventilation is on, that is going to clear out most of the risk. At that point, it's really the people who are seated immediately around you that you could be infected by.
Right. That's great.
I totally agree with that. I've done that same experiment. It's scary how high the CO2 goes up. We didn't touch about was Paxlovid. Look, it's an effective drug. The first studies on it were really comparing it to it was in unvaccinated people, right, Celine? So it had a tremendous, benefit. It had a less dramatic benefit once you were comparing it to people who were vaccinated, but still in people who are at increased risk, absolutely helpful. The wrinkle, of course, has been Paxlovid rebound, where you finish the 5 days and then anywhere from 2 to 8 days later, you turn positive again, and then you can stay positive for a while. So I think it's been taken a lot of clinical judgment. So there was a question, somebody said, are there medications where you don't have to stop taking medicines you're already taking? There can be interactions. It can get very tricky. So there are some people who you just wait it out. You have to take it within 5 days of symptom onset. And there is a trial, I'm told, going on right now that's comparing 5 days versus 10 days of treatment to see if the 10 days maybe is associated with a lower rate of this rebound. And then finally, I just saw, you probably saw it too, Celine, that there's a trial of, is it 15 days of Paxlovid for long COVID?
Yes.
Because there is some evidence that you may have some reservoirs of virus. You can shed it from the GI tract and stool for months, the RNA, for months after somebody has COVID. So it's got to be hiding out somewhere. And the thought is that maybe by giving Paxlovid, you can get rid of some remaining reservoirs and then stop the immune system from fighting a battle that should be over, with the thought that it's that immune system that's ongoing, having a battle that's causing a lot of the symptoms.
Yeah, so a few comments on that. We have more studies now of the use of Paxlovid in both unvaccinated and vaccinated people. And there's no question you have a reduction in risk. Even if you've been vaccinated, you have a further reduction in risk in terms of progression of severe disease, hospitalization, and death. We have more data now that shows that taking Paxlovid reduces your risk of developing long COVID. So it's another reason to take Paxlovid. And of course, the study you mentioned out of Yale, where they're looking to see if once you have developed long COVID, if Paxlovid will help treat that. With respect to, are there alternatives that you could take that would not interact with other medications? I mean, I suppose you could say remdesivir, but remdesivir is an IV medication you would need to take in the hospital. And it's really very few medications where you truly have to dose adjust or stop the medication while you're taking Paxlovid. And so I think, for 5 days, if you're having to stop, that's a pretty short period of time. There's very few where that really becomes an issue. And the last thing I wanted to mention is with respect to the rebound that you see with Paxlovid, we also see rebound with people who are not getting Paxlovid. So that may not actually be related to the drug. That may just be about COVID itself.
Wow.
Yeah, I mean, there's been a lot. So David Ho up at Columbia has been doing some studies on that. His thought is that you're freezing the virus in the middle of various stages of replication. And then when the Paxlovid washes out in a day or so, it just starts up again. But yes, there are people who get it even without taking Paxlovid. So Yeah, there's a lot still to be know. What's that other one? I always forget the one starting with an M.
Molnupiravir, and that one's actually being taken off the market.
Yeah.
It's just not as effective.
Right.
There were more concerns about what it would mean for, say, a pregnant woman to take that. So that one is being taken off the market.
Yeah, anything with 5 syllables or more, I'm not memorizing unless it's going to be on the market and I'm prescribing it.
Dr. LaPook, before we go, you look at the private chat because I'm trying to. It's a question from Seth.
Okay.
And I wonder if he's doing it from like the point of view. I don't know if a devil's advocate point of view. I texted him to get clarity.
Okay. Yeah.
I don't quite understand it, but maybe you do.
So Seth is saying, why should we be scared about getting COVID? Isn't it because we don't know how our bodies will react, even if we got it before? And I think that's right. That, what is it? How lucky are you feeling, punk? Remember that movie with Clint Eastwood? Does he have a bullet left or not? Anyway.
Right.
How lucky are you feeling? So how lucky are you feeling? It's definitely a risk to get COVID. You don't want to get COVID. It's always like if you're that one person who gets really sick or dies, that's 100% for you. So we know people who've been vaccinated, who have gotten COVID and died, or have gotten long COVID. We know people who get mild symptoms of COVID and go on to get long COVID. We know people. It seems like it's a vasculitis. It's causing inflammation in the blood vessels. So you wonder about why you're getting brain fog, why you're getting multi-system involvement. It's because it's affecting things all over your body, including blood vessels. So it's not something, I don't think, it's not something that's like, okay, I got COVID, no big deal. You may very well do well. And in fact, if, as Celine implies, if most of the mortality is over 65, if you're younger, the odds are you're going to do pretty well. But guess what? This pandemic's 3 years old. We don't know the long-term effects.
Right.
We don't know it yet. And we're still learning. If there's anything this pandemic has taught us, it's that be humble, take the data that you know today and try to think correctly, be logical about it, make sure people know I'm telling you information based on what we know today, but it may change tomorrow.
Right.
And don't say to the weather person, I can't believe you told me to wear, a raincoat yesterday when today it's sunny.
Right.
The weather changes.
Right.
And I think that's been a real theme that people have said. Why didn't you tell us? Why didn't you tell us there was more uncertainty? I don't know. I kind of heard that being said by a lot of public health figures all along, but I think we didn't communicate it well enough or say it every single time. We spoke. We didn't say it.
Hopefully that'll be one of the lessons learned. As you said, I mean, most likely there will be another pandemic. The question there will be one. The question will just be, will it be in our lifetimes or not? But regardless, hopefully lessons will be learned and applied in the future.
Yeah, but I think people should. There have been a lot of negatives from this pandemic, of course, that goes without saying. But it's pretty astonishing what happened in such a small amount of time. It used to take like a decade to make a vaccine. Right. It was made in less than a year. The antivirals came out. People got ramped up, and then we went off the tracks because it became politicized. And how that happened is somebody's 2,700 books and a PhD thesis. But Celine, I would love, because Celine really has a very wide and experienced view of this. I'd love you to end and talking about, so when people look back over the last 3 years and then look forward to what's ahead, what would be your take and your advice and trying to put this all in perspective?
Well, I think not only will there be a pandemic in our lifetimes, if I were a betting woman, I would say probably in the next decade.
Wow.
And so I really think we need to be thinking about how to prepare better with respect to public health. And unfortunately, we are seeing public health powers at the state and local level becoming weaker. They're being weakened. And so the next time we have an outbreak, we will have fewer tools at our disposal. And imagine if somebody had Ebola and landed in New York City and was walking around Times Square, and public health officials did not have the power to take them for isolation at the hospital. We are moving in that direction right now in many places, and I think that's really frightening.
Yes.
I think the main lesson I would like people to take away, I fear that we haven't, is that these are problems that need to be addressed collectively together. These are not problems we can solve on our own. And that will mean investing in collective approaches like public health departments and infrastructure.
Let me ask you before we leave. So, Dr. Gardner, so you're saying within a decade, you were on President Biden's advisory, a task force. What was the exact name of it for?
The Biden-Harris Transition COVID Response Team.
Okay, so I mean, I just want to know that I'm guessing that the administration knows this. Administrations at the state levels, even this county and city levels for health officials. What is the collective response? Is it exhaustion and the public isn't listening? Because within a decade that's pretty soon.
Well, I think what you're seeing is a funding problem. So you're seeing a lot of attrition right now at health departments. We saw this during the pandemic. My colleagues at the Kaiser Family Foundation have done a really nice job of tracking some of this. So we've lost a lot of public health leaders across the country, over 300 public health leaders at state and local levels at last count. And so that means you have a lot of institutional memory and expertise that you've lost. And then there's also just been a gutting of just regular staff.
Right.
And so that means we're really underprepared. It's not that people don't want to do the work at public health departments. There's just not the money. People cost money, and so when you're asking somebody to do work, you need to be able to pay them. And we just haven't invested in that. We're pulling money out right now of that kind of activity. And, I would hope that Congress would step back and say, as we take stock of what's happened during the pandemic, that we would approach public health just like we do our investments in the military. These are national security investments.
Right.
It's health security we're talking about.
Right.
And so
I'm just going to say it's really incumbent upon everyone watching to notify their local, state, and federal representatives, elected officials, to say public health is important to me. Where's the money? I mean, that's what it sounds like to me. It's incumbent upon all of us to make sure that we're heard and that this is important.
And I know that Celine and I both feel strongly about health equity and about how this has been a stress test of the public health system and our entire national structure, that we have failed in terms of health equity. I mean, with mortality rates being 2-3 times higher in certain communities of color, on and on and on. That would be a whole 5-hour, symposium. But I think it's very relevant to how interested people are in fixing the problem.
Yeah.
When there's such a disparity.
One more thing. There were several people in the comments that were asking, when May 11th happens, will the statistics, those daily statistics that you're talking about, will they still exist?
So this is going to change. After the public health emergency ends, the Department of Health and Human Services, which includes the CDC, will no longer be able to require labs and health facilities to report their COVID data to the CDC. Now, some may still do so, but it's going to mean that you're going to have very spotty data, and very likely the places where you have the greatest inequities, the highest risk, the least investment in public health are going to be also the places least likely to report their data. So we're really going to have a blind spot where the risk is greatest.
Wow.
Yes. And if you want a specific example of that, when I did the story for Sunday Morning about public health system, I went out to Oklahoma City and took a picture of the fax machine that was being used for doctors to ask for COVID testing because it was the only secure way of communicating, when electronic handshaking in a secure fashion's been around for decades. And Celine makes a great point that once the emergency is over, The CDC, Rochelle Walensky told me this when we did the 60-minute piece on her a year ago. I can't believe it's been a year ago. They don't have the power to require these local governments to send them information.
Wow.
So the handshaking's not there, the data infrastructure is not there, the power to do what they have to do is not there. So we got a lot of work to do,
right.
and we know what's coming. We know what's coming. It's just very predictable. Nobody's going to want to be right about this,
right.
But that's what's happening.
Dr. Gounder, thank you so much. Thank you, Dr. LaPook, for asking Dr. Gounder to come on. This has been a really informative, important, necessary discussion.
I knew she'd be great. And Celine, welcome to Stars in the House. I will tell you one of the uplifting things about this whole experience, because Stars in the House has really emotionally for me been fueling me and fueling my how well I'm feeling and holding up. If you go into the comment fields and see what people are saying, yes, it's a select group of people who maybe we have a special filter, but they have listened and they bring it back and they go, they've learned and they're changing what they do out there in the real world. And it gives me hope that we can, you and I, we're on national television. I want to triple our efforts. We're talking about doing more things together to educate people. It can work, but it's hard work. And we had every single day at the beginning, it was twice a day, right?
Yes.
If you talk to people every single day and you get their questions and you answer them and they're there. So I do have hope that we can do a better job educating people and teaching them about science so that they can make these decisions themselves. You have to live your life. You can't say, John, Celine, what do I do now? I'm at 72nd and Broadway, and I'm wondering if about how it's spread, about the things that you can do, the layers of protection, and you can start to make the decisions you need to make, like having your grandmother hug other people,
right.
Or your mother hug people. And I stick by the original kind of tongue-in-cheek pillow that got made, my saying, hashtag don't kill grandma.
That's
right. Hashtag don't kill grandma. Think about the people next door. Right. Anyway, so thank you to all the people out there in
Yes, and absolutely. We forgot it before we brought on Dr. Gounder. David put what we just made just from our anniversary show, $1,876 from last week's show. Thank you, viewers, for donating to the Entertainment Community Fund. Really, thank you so much.
So our grand total's over $1 million.
We're approaching $1,200,000 for the Entertainment Community Fund and over $500,000 for other nonprofits, including Ballet Hispanico. Yes, we're very fortunate to have a very loyal, devoted audience to Stars in the House.
Well, Celine, welcome aboard the good ship, Stars in the House.
Yes.
Happy to be here anytime you want me.
All right. Thank you. All right. Thank you, David.
Good night, everybody.
Thank you, everyone. Good night.
Good night.